Hello, North Central Washington. Welcome to Network TV, where we bring you the latest news and insights on technology, education, and entrepreneurship across the region. I'm Jenny Rojanasatian, Executive Director at NCW Tech Alliance, and your host on Network TV. In today's episode, we'll be exploring the digital divide in North Central Washington and the efforts underway to help bridge this gap through the NCW Digital Equity Initiative. The digital divide in North Central Washington refers to the unequal access to digital resources and technology. This could be lack of access to Wi-Fi, then the lack of access to a physical device, whether that's a laptop or a smartphone, and from there, the understanding of how to use them for the betterment of our lives, from telehealth to education to remote work. According to the 2020 U.S. Census, up to 19% of households in our region lack an internet connection, with a further 10 to 23% not having a smartphone at all. It's this lack of digital resources that affects economic and learning opportunities, civil engagement, and access to critical social resources. The NCW Digital Equity Coalition is working to bridge this gap by eliminating technological barriers to healthcare, employment, education, and other essential social supports by providing access to resources, training, and to support community members in need. This Digital Equity Coalition is a partnership between the Community Health Network of Washington, NCW Tech Alliance, the North Central Accountable Community of Health, and the Bigfoot Telecommunications of the Colville Tribes. With the focus of serving residents across Chelan, Douglas, Grant, and Okanagan counties, as well as the Confederated Tribes of the Colville Reservation, this is a wide expanding program. Joining me on today's episode is the Community Health Plan of Washington, one of our key partners in this work, to share more about the initiative's efforts, how you can get involved. If you're interested in learning more, we've got some available resources on our website at ncwtech.org/techhelp. Of course, we're going to explore all of those resources right here on Network TV on the NCW Life channel. Don't go too far. I'll be right back on air with our guest. And welcome to Network TV, where I am excited to introduce my guest and now friend, because we've been working quite a bit together here, Gerardo Perez-Guerrero. Did I say that right? Oh, you got it, Jenny. All right, but you let me call you Jerry is how I've known you.
Mm-hmm. Yep, okay. Jerry. My family calls me Hera. My close friends call me El Toro Bravo, which means angry bull, but which is ironic because I'm always laughing. So
you are probably the happiest person I know, so that is a funny nickname for you to have. Maybe a story for another time there. Well, welcome. I'm so excited to spend a little time one-on-one with you today. We're going to dive into the incredible work of Community Health Plan of Washington, some initiatives with Link to Care, Tech Help, the Digital Divide, but you've got an incredible background, and I'd love to start with our audience here getting to know you.
Perfect. Well, thanks, Jenny. So yeah, like I mentioned, my name is Jerry, and I like to say that I feel I was manufactured in Mexico, but then assembled here in the USA. I feel like I have two hometowns because I was born and raised, at Central. I'm pointing to the hospital, Central,
yeah, right
over
behind
there,
us, yeah.
right, somewhere in the background. Yeah. I was born and raised, and then my parents, they really wanted me and my siblings to have a connection to their hometowns in Mexico, and so my second hometown is a little town called Juarez, not to be confused with the city of Juarez, but it's in the state of Hidalgo, which is very close to the city of Mexico, but very, very rural.
Okay.
And so we were able to travel back and forth, got to meet my family, and then I think how this word digital equity or navigation is really, I've been thinking about this for quite some time since we started doing this work in that very rural town in Mexico. When I was living there, this is about 25 years ago as a child, there was really no connectivity. It was very rural, and so I remember that way that we would get in touch with our family back here in Mexico. There was one phone for the whole town, which was located in the center of the town. And essentially, And that's where we actually still relied on a person to deliver messages. They would hand deliver messages, and they would tell you, hey, you're going to get a call from so-and-so at this time, so make sure to be there.
Wow.
And so, but it's really interesting because these last, 10 years has been a really big transformation, going from one phone for the whole town, and then slowly but surely, homes got their own phones, and then eventually people got their own cell phones, and the cell phone coverage started to expand. And then, as we know, cell phones became smartphones, and so now they were able to call and then get connected in many, many ways with many different apps. And so my parents, they were there not too long ago because they like to go. They're winter birds, and so they'll go out there, avoid all the snow.
Smart move, yes.
And essentially, I was able to have a voice conversation, or not a voice conversation, but a video chat with them. And I saw family, and I think that's just really thinking about it, such a powerful tool, because a lot of folks they'll have to come back here maybe if they're still working, but they leave their family behind, and so I think having that such a powerful tool in their pocket to just keep eyes on their loved ones. And so I definitely felt that when I saw my uncle, who I hadn't seen in a long time.
That's an amazing story. Technology is one of those tools that we can use to stay connected. There's so many important social things that we can use technology for, not just the work, you know what I mean, for business, work, and school. So I love that. And travel is hard. Not all families can travel to spend time with each other. That's also a financial barrier for a lot of people. So you can use technology to see relatives you haven't seen in a long time. I love that. Now, what about your career here in North Central Washington? Tell me a little bit about your journey to get to now at Community Health Plan of Washington.
Oh, great question. So to transition from my childhood, when my parents first came here, the options for healthcare, we really went to Columbia Valley Community Health many, many times. I think that was a place where they trusted and knew that maybe they didn't have all the money up front, but we would still get our care. And so as a child, I remember getting my teeth worked on there, or just other basic things in their pharmacy. And I think this is when their location wasn't where it was currently. And now there's been so much amazing growth that they've done. But then Columbia, to wrap it up to how it fits to my career. And so actually just a couple of years ago, I noticed that there was this position for regional manager for the Community Health Network of Washington. And their mission statement really resonated. And again, just having that close connection that when my family didn't have many places to turn for healthcare, that's where they were able to go to the clinics. And so I think it's a mix of personal connection there too, and how it led me to the network.
Thank you for sharing that story, first of all, with us. And I think that's a really powerful testament, too, of someone who's used the services of a health network and a community clinic, and then now you're empowering and providing more support for others. So kudos to you.
Yeah, no, thanks, Jenny.
So now at the Community Health Plan of Washington, tell me about your role there.
Yeah, so currently I'm the regional manager covering Chelan, Douglas, Grant, and Okanagan counties. And what that does is, or what that means is, I work very closely with our behavioral health providers and just making sure that I'm, someone that's visible in the community. If I hear any trends or notice something where I think we could help, leverage the resources and expertise that we bring, then that's where I help make connections and get the balls rolling. And I think that's how the story started here for what we're going to talk about today about NCW Tech Health. Yeah,
the digital equity piece, so important. For those though who may not know what a community health clinic is or community health network, can you give us a little background there?
Oh, definitely. So the Community Health Network of Washington, it got started back in 1992, and essentially the community health centers, they all got together and decided it was time for a change. We want to make sure that the communities we're serving are getting, quality and equitable healthcare that meets their unique needs. And so the Community Health Network of Washington was founded by these clinics and essentially for Washington. And to this day, our focus is Washington State. And so right now there's 21 community health centers across the state. We're actually, they're our boss, and the bosses to them are the community. So in a way, it's all, serving the best interests of the community.
And so kind of a collective impact model to help support what are traditionally kind of smaller, very regional, local-based health centers versus maybe a major healthcare institution, right?
Yeah, and some of these you may already know too. So like I mentioned, Columbia Valley Community Health here for Chelan and Douglas counties, Family Health Centers in Okanagan County and the northern part of Douglas County, and then Moses Lake and Quincy Community Health Centers in Grant County. So you may already know some of these partners already.
Absolutely, amazing, amazing work that's being happening in the community. Now, you, through Community Health Plan of Washington, you applied for a grant through Commerce to impact the kind of digital divide. Why pursue this grant? What were the trends you were seeing?
Mm-hmm. Yeah, I mean, I think it's a great question because it asks, as a healthcare company, why expand to
why
that
technology?
area, right? Why technology? And I think it's, I've noticed a really big trend now, the smart approach to making sure we're really supporting the community as best as they need is recognizing that healthcare is just but a single piece, and that overall something that affects their well-being. There's also housing that could affect it. Do they have access to stable housing, or what does their food situation look like? Are they getting access to, healthy foods? Also, is there any economic opportunities that they may have access to or not? And so all these things just really impact a person's well-being. We like to think that healthcare, it affects a person's 100% of their well-being, but really it's, it can be in some cases just a sliver of that, and there's bigger pieces that affect a person's overall well-being. And I think with telehealth, what we noticed with the pandemic, when everything shut down and people were, told to stay home, but they still had their healthcare needs, that's where having, the smartphone, such a powerful tool to get them connected with their providers while they were, in quarantine. But now, even though we're still in the pandemic, the public health emergency hasn't ended. This is such a powerful tool because, you could be seen in the comfort of your home, or maybe transportation is such a big challenge. Maybe you live in a very rural part of this region and you can't easily go see your healthcare provider. So for those appointments that it makes sense to be on your smart device, then that can be, such a powerful tool.
Yeah, absolutely. And I think the pandemic has fundamentally shifted the way some healthcare services are delivered or looked at, because you can access technology. A cardiologist doesn't have to drive to a rural clinic. A person in a rural community can zoom in, right, for that check-in visit. So it's kind of changed a little bit how healthcare is being delivered. Tell us about the grant that was that you applied for, because in the next section we're going to really dive into what it's bringing to the region.
Yeah, so not too long ago, I want to say October of last year, that's when we were notified by the Department of Commerce and their Office of Broadband that we were awarded a $1 million grant here for North Central Washington region, which was very exciting because what our hope is to address digital equity, because like you mentioned, or as we've been talking, not everyone has that steady access. Sometimes, providers have to go to the people, or the people have to, find a way to get connected to their provider. So what our hope with this digital equity piece, and something that we've been, really delving into, it's going to take a comprehensive approach. You just can't, blanket the community with smart devices, because then you make the assumption that everyone knows how to use a smart device the correct way. Because the example I always give is my parents, grandparents, they know how to use Facebook Live, or they know how to, get their information that way. But if I told them, hey, Grandma, let's set you up with a Zoom appointment with your doctor, and I think I'd get that blank stare and be like, what are you talking about, mijo? I want my phone back because I want to go on Facebook.
Absolutely. I think those of us who are more tech savvy have evolved with technology and learning new applications, but those who have never used it before or never had access to it before, it's a real learning hurdle. Well, we're going to head out to a commercial break, but when we come back, Jerry and I will be diving into NCW Tech Help and some of the initiatives there. Don't go too far. And welcome back to part 2 of Network TV today. I have been joined by Jerry with the Community Health Plan of Washington, Community Health Network. I use them interchangeably there. But the long and the short of it is we have been talking about digital equity, some of the trends that your organization saw during the pandemic as far as telehealth, and more broadly, how the implications of lack of a connection, a device, or the literacy of how to use that it impacts a wide range of social issues. So now we're launching NCW Tech Help between our two organizations, which is pretty cool. Why don't you tell us a little bit about maybe the goals are under the grant as we dive into that conversation?
Oh, definitely. So yeah, like Jenny mentioned, NCW Tech Alliance has been an invaluable partner in these efforts, along with the North Central Accountable Community Health and also Bigfoot Telecommunications. They're the telecommunications provider for Colville tribes. And when we first, one of the trends we noticed is I always think of Mr. Rogers when he says in a disaster, and I'm not calling North Central a disaster, but rather in his example, he says, look for the helpers. And that was one of the things I noticed was there was already a lot of passionate organizations and individuals doing this digital navigation and equity work. Maybe they weren't calling it that, but that's how we recognize it. And so, in the first segment, I talked about one of my roles is connecting the dots and connecting partners. And I think this is where we didn't want to duplicate or, come in like a wrecking ball and say, we're going to fix the problem, but rather, hey, how can we fix this together? Because there's another saying from the previous director of North Central ACH who says, if you want to go far, you go together. And so
I love both of those references, by the way. Look for the helpers, and if you want to go far, go together.
Oh, definitely.
Yes.
And so some of these goals, because like we were talking about, to really get to comprehensively address, digital inequity, where it's going to take a really comprehensive approach. So like I mentioned, it's having that smart device, it could be a smartphone, a tablet, but something that can get connected. And then the other piece too is that connectivity, making sure that you have sufficient broadband, because just because you have Wi-Fi, I think we've all been frustrated when we try to load a video or something and it's very laggy, there's not enough broadband, and so making sure that connectivity is where it needs to be. And then the third piece too is that digital literacy, just knowing how to use the device. I think, for me personally, I have the benefit of just like slowly grew up with computers. My schools, they taught us computers, but then, you talk to certain generations and they may not have those skills. And so again, making sure that they also have those skills as well. And so for NCW Tech Help, what our goals are going to be is helping train, we have a very ambitious goal. We want to train 300 digital navigators across Chelan, Douglas, Grant, and Okanagan counties. And we're certainly going to do our best to meet that goal. And the way we're going to help train is in-house. We've developed a digital navigation curriculum. We have it, so it's not just me doing this work on behalf of Community Health Network of Washington, but there's also a team, and the team has developed this curriculum that's really geared for adult learners to help them, how to recognize and teach for digital literacy and digital equity.
And tell us a little bit. I'd love to dive into that. The team has been really working hard since last October through this grant, and to create a curriculum and program that would be effective. You went through the first training yourself, right? The pilot. Tell us a little bit about the types of things the training will include, maybe. Like, if I was going to sign up to be a digital navigator, what are some of the things I'm going to learn to help others do?
Oh, definitely. So I think, one of the key pieces is recognizing that this work, or like I mentioned earlier, there's a lot of partners doing some of this work already. And then also at the federal level too, there's been a lot of initiatives to address digital equity. And one of them is the Affordable Connectivity Plan and Lifeline. And so part of the curriculum is going to help teach what does that eligibility criteria look like. So that way, in the event that NCW Tech Help may not be the exact solution for that community members need, then there's other resources that we're also leveraging, because again, we wish we had all the solutions and answers, but that's where being very aware of the other efforts is going to be so valuable to make sure that we're covering as many gaps as we can.
I love that you called that out, that there's a specific criteria in which people can get discounted services, right? And a lot of people don't know that that's there. So a digital navigator will be able to say, here's the eligibility criteria, and if that person qualifies, help them get connected to those discounted services. That's huge. Yeah,
and I think just having that person be a support, because what we've seen in healthcare, this idea of having a navigator for digital literacy isn't new, but rather something that we use in healthcare quite a bit, because I put myself in when I was a child, going back to my past, it was my parents that were navigating that, but I think the reason they trusted so much at the clinics was they had people there that they could ask questions and felt reassured that what they were doing was the best choice, instead of being just bombarded with information left and right, just feeling alone. So that digital navigator is going to be really a person in that community member's corner.
I love that. And the digital navigators are going to be embedded through other community-based organizations. Tell me a little bit about that.
Oh, great question. And so right now, we won't have 300 Community Health Network employees as digital navigators, but rather, like I mentioned, there's already so many great efforts happening. So we want to offer this curriculum to any of the organizations here. So definitely including healthcare partners, but this could also be library staff. This could also be, frontline office or frontline workers at the facilities themselves. And so it could be someone that's like a community health worker or a promotora de salud. And so our hope is, and that's why we're doing so many different marketing things to help get the word out that these trainings are going to be happening. And then we do have some exciting incentives too, just because we recognize right now there's just so many staffing challenges. And so to help hopefully make that an easier decision for the leadership or the people managers to send their staff to these trainings, there's going to be currently $500 per participant as long as they complete the training, and then afterwards complete 10 digital navigation encounters.
Yeah. And I want to build on that for just briefly here. So in a community-based organization, whether that's a healthcare focused organization or a library or community partner, can send kind of nonprofit staff or traditional staff or even volunteers, right? To learn more about, to participate in a digital navigation training, and then they kind of get deployed in their own network to be that resource.
Oh, definitely.
Okay. Yeah.
So
and then you're doing a value back to that organization with that small kind of grant award.
Oh, yes. And like I said, so hopefully this is, you know, a digital navigation toolkit that you want to see implemented in their staff.
And what happens after the grant period concludes, Jerry? So what does kind of the future of this program look like?
Oh, great question. And so, so like I mentioned, October of last year, 2022, is when we were awarded the grant, and then the original grant period ends here in June 30th. But we, as a company, we've made that commitment that telehealth is part of our strategic 5-year plan, and so that's where we are already hard at work finding other grant sources, because you know, eventually this grant funding will end, but then that's where, you know, we are already engaging in, you know, what do other funding sources look like? You know, how do we continue this work? Because one of the other goals of NCW Tech Help is once we have those digital navigators trained up, and then also another goal is we're going to have a limited number of smartphones, and so we're going to have to be very strategic in how we distribute it. And right now, you know, we want to make sure they get in the hands of the community member that's most in need. And I think that's where having the digital navigators, once they have that curriculum, they'll be able to help assist in identifying, because I think they, you know, are the local experts on who's the most in need, and so we're going to be looking to them to help, you know, guide those efforts. And then finally, and then I know there's so many goals and objectives.
So many layers, yeah.
So like I mentioned, it's
work,
a comprehensive approach, and the other piece too is there's this Link to Care Washington hotline, and that's something that is available to anyone in North Central, regardless of their insurance or income. And I'm sure, and the number is 866-757-1832. That's Monday through Friday, 8 a.m. to 5 p.m. And that's where you can get further digital literacy support. And then,
so you don't have to wait for a digital navigator to meet with one. You can call that hotline now.
And I think the curriculum too will cover how do we, you know, how can they use Link to Care WA to help those efforts. So, because Link to Care WA also funded with another grant from Department of Commerce, but that will be something that definitely continues as well.
Plus, the digital navigators themselves will have the training and be, you know, anchored in so many different organizations. I'm sure they're going to continue to assist and share that knowledge. So really spreading out that education and support for the years ahead through this program.
Oh, definitely. That's one of the reasons we wanted to take this approach, was going to be, the, you know, what does the long-term impact of this look like? And I think by having this train the trainer approach, hopefully that gives us that long-term impact that we're hoping for.
Well, this is incredible work. At the Tech Alliance, we're really proud to be a part of the initiative in partnership with so many other organizations, because like you said, this is about people working together to go far. So thank you for your leadership. As always, we go too fast on this program, so I want to encourage everyone to go to ncwtech.org/techhelp, where you'll have links out from there to Link to Care, including the phone number, information about digital navigators and how you can become one, as well as some additional resources. So Jerry, thanks for coming on air. Look forward to the next time you're here.
No, thanks Jenny for having me.
Yeah, we'll see you next week right here on the NCW Life channel.